In part 2 of our foam rolling series, we are now going to go over how to release the soft tissue structures of the hip or the gluteal area. This is one area that typically gets overlooked in most people when foam rolling. Again, this is a scalable approach. What you want to do is grab your foam roller here, find a nice open space on the floor, and it's important to actually scan across the fibers of the glutes here. There's a lot of very thick and very deep muscles in the hip. So it's important that you put a decent amount of pressure into these things because you might not even find some of the trigger points that lie in the deeper structures. So thorough detective work here is best practice. What you want to do is sit yourself on top of the foam roller, and the territory that we're going to be rolling as far as up and down is concerned is in between the top of the pelvis and the bony part of your butt where you sit. So now, what I usually instruct most of my patients to do is actually to cross one leg over the other. So say I wanted to roll my left hip here, or cross my left leg over my right leg. Again, tripoding myself back here so as to not put too much pressure into the area at first as we're scanning. So you want to be scanning back and forth between the top of the pelvis and the bony part of your butt where you sit. Now, depending on the angle and orientation of your hips, so say here versus here, you will actually hit vastly different muscle structures. So I always encourage scanning back and forth, going across the fibers here, just doing a general scan to get an assessment of exactly where your problematic areas lie. And as you end, you want to try to get the thigh as close as you can to being on top of the foam roller here. You can also use your back hand here to put on top of the foam roller to control the fine movement. Scanning through here, a lot of people tend to find trigger points very deeply embedded in the side of the hip or in the lateral stabilizers and external rotators. So this would be putting a moderate amount of pressure in. Now, if you find that you have more muscle mass here, or it's just not enough pressure, what you can do is actually take this leg, slide it underneath the opposite, and then drop down into your forearm here. Now, this will actually relax those glute muscles and allow you to get into the more deeper structures of the hip. Again, you can put your hand here to stabilize the foam roller, and the more you walk this hip back underneath your opposite leg, the more you can get into the lateral structures here. But again, you want to scan side to side across the fibers to find exactly where the problematic area is. And again, as best practice dictates with foam rolling, 45 seconds to a minute each spot that you find, and then you move on. Again, repeat this for the opposite hip as well. And that concludes the foam rolling tutorial for the hip and gluteal structures.